Frank's presentation, by far it dwarfs other sources of cancer risk in New Jersey from air toxics. I think it's important to keep in perspective that the DEP's threshold for public health significance, is 1 in a million cancer cases. I think it's important to consider that we have about a 40% chance in our lifetimes, the average person, of getting some form of cancer, which is 400,000 in a million. So, when we talk about 1 in a million risk, we are talking about concerns about cumulative risk from multiple exposures to multiple carcinogens, as well as how other factors may combine in terms of health disparities and cumulative exposure and cumulative risk. But again, the absolute risks are often not so great, but in combination or perhaps because of synergies and other interactions may be more concerning. Next slide, please. So Frank already talked about how we get our information from central monitoring as well as modeling primarily. So next slide, please. So I'm going to focus again on diesel particulate matter and a little bit on benzene and formaldehyde, which actually sort of go together because diesel particulate matter, is really a marker for diesel exhaust, which includes about 40 different carcinogens, including benzene and formaldehyde, although perhaps not the major source of those other air pollutants. Next slide, please. So this slide, borrowed from the DEP, shows how diesel particulate matter in terms of cancer risk in New Jersey, dominates all other compounds combined. Next slide. And if we leave out diesel exhaust for cancer risk, then formaldehyde and benzene are the next leading causes, contributors. Next slide. All right, so a little bit more about the measurements that are done. As Frank pointed out, we have what might be called urban air toxics sites at the Elizabeth Lab in Newark, and then also at Camden. And then we might call Rutgers a suburban site and Chester a rural background site. I want to talk a little bit more about the specific sites, especially the urban sites. Next slide. So those of you who may not be familiar, the Elizabeth Lab Central Monitoring Station is located at exit 13 on the Turnpike or off the Turnpike, right next to the toll booth there where that red star is. So if you might think, well, certainly it's an urban area, and certainly it looks like it's really in a hot spot, right? I mean, it's hard to imagine there being a hotter spot maybe for diesel exhaust and mobile source air pollution here in New Jersey than right here, perhaps. Next to the toll booth where cars are idling perhaps at times and then accelerating, which is associated with less efficient combustion, perhaps more VOCs, more particulate matter generation. And then right there, within perhaps 100 or 200 meters of the Turnpike and then Route 278. So I want to keep in mind when we talk about what we measure at this site, the fact that, again, it's hard to imagine that there will be a hotter site for diesel particulate matter in the state. Next slide. And this is Camden on Google Maps, the Camden site at Spruce and Locust. And here, we'll see that both, and we saw already in Frank's slides, but I'm going to show a few of those already and really emphasize the differences between the sites. But so both Camden and Elizabeth, have the highest levels of measured air toxics for mobile sources. But here in Camden, it really isn't, as far as we can see here, a major mobile source site. There's 676 there, a little bit to the east. Maybe it's a little bit more downwind. But upwind, we have Philadelphia metropolitan area. So probably about a half a mile there across the river, that's Philadelphia, downtown Philadelphia, the whole Philadelphia metropolitan area. So this site probably represents more mobile source and other, when it comes to PM, other source PM from the metropolitan area of Philadelphia. There's a light industry there, a metals industry, there's a gypsum plant there and so on. And there's vessels in the river you can see there that, maybe sources of PM that are more local. But this is probably not so much a hot spot, perhaps as more like a urban background spot. So go to the next slide, please. Frank showed these slides already, and, he emphasized, and, it's very important that the levels of elemental carbon here, especially in the urban area there, Elizabeth, which I've labeled with the yellow line coming down. But what I want to emphasize is that if we look on the right side there at present levels, 2021, we see that there's still great disparities. So the level of elemental carbon, which is a relatively specific marker for diesel exhaust, is about 300% greater than Chester, about 4 times as great as Chester, the background. And also at Elizabeth there, it's about double or maybe a little bit less than Newark. So Newark is a urban sort of background site. Also, the firehouse in Newark, not particularly in what we might call a hotspot in Newark. So what's the difference between Elizabeth and Newark there, I think, is the local sort of hotspot factor. The local emissions from all that traffic on 278 and the turnpike around the toll booth. Next slide. I'm going to go over this again because Frank already talked about it, but I think if you go to just look at the 2017, which is similar to today, it's definitely gotten better since then. The next slide shows that. Go to the next slide, please. But there's still disparities where parts of the state are diesel particle risk, which is really proportional to the amount of exposure, because we use a linear no threshold model. The risk is proportional to the exposure. So we see still in areas there, Hudson County, where the risk is still perhaps about 500 in a million, whereas other parts of the state 50 in a million. So tenfold difference in risk. So definitely, diesel particulate matter obviously is a environmental justice issue and an issue about disproportionate risk. Next slide. And then we look at benzene, and very similar. We see the urban sites, Camden and Elizabeth. We don't have Newark for benzene, about double perhaps of Rutgers and Chester. Next slide. And then, as Frank pointed out, this map, doesn't show the disparities because the turquoise color is 1 to 5 in a million, which is a 5-fold, limits. So there's still double or triple or perhaps even 5-fold differences in risk at different parts of the state for benzene. Next slide. And then formaldehyde, again, about double in the urban areas. Next slide.
Last chance, you definitely don't want it.
And there too, we don't see it when we have a map that has relative bins of exposure that extend over multiple levels of risk. Next slide. All right, so here's the crux of my presentation, which is about low-cost monitors and particularly purple air monitors, and what we can expect that they're going to be able to tell us about urban air toxics and especially about diesel particulate matter. So these monitors are inexpensive, less than $300, and they're quite sophisticated and nifty for that, and they can certainly be useful in some circumstances. So they measure PM 2.5. They have 2 sensors, which helps with quality control, and they're optical sensors, which essentially count particles and then convert that to mass. They hook up to Wi-Fi. The results go automatically on a map. There's like averaging done by the central software over various time periods, and they take measurements about every minute. So here we see in Moravlog apartments in Elizabeth, one of my graduate students working with some of the maintenance folks there putting up one of these monitors in Elizabeth. And then there's a map there showing you how your data gets up on the map immediately. And so there's been a lot of promotion of these monitors to measure hotspots in communities. The EPA recently funded at least 2 projects here in New Jersey that include some particulate matter PM2.5 measurements, including with purple airs. And I know there's at least 4 or 5 projects, throughout the state that are using purple airs. And I think for a lot of those projects, and I think a lot of the projects around the country, there's an expectation that these monitors are going to be able to pick up diesel particulate matter, which, again, it's not just a problem in New Jersey, it's a problem in urban areas around the country. Next slide. Next slide, George. All right, so there's a monitor there. It has a temperature and humidity sensor, which allows you to control for temperature and humidity, to adjust for it. So overall, I think it can be a pretty reliable PM2.5 monitor. But the problem is that the main problem is the monitor has its issues as well in terms of limitations for measuring PM2.5. But the main problem is that PM2.5 is not a good surrogate marker for diesel particulate matter. Most of the diesel particulate matter from near sources, like at exit 13 on the turnpike, for example, is very, very small particles that can't be seen by the monitor because it's an optical particle counter. So particles less than 0.2 or 0.3 microns can't be seen. And then the other issue here on this graph being shown is there's a reference monitor there, co-located. We co-located these monitors with the DEP's central site monitor in Newark, and that's the yellow line. But I want to point out that the other 3 monitors are all purple airs, and you see how they differ by about 10 or 15% from one monitor to the next. And there's a bias for the one that's the blue line there being about 10, 15% or more lower than the other monitors. Next slide. So here's the crux of the issue, I think, which is this is showing the DEP's monitoring at sites, central sites throughout New Jersey. And what I've circled there is the Elizabeth lab, the highest peak there that's circled on the left, and then Jersey City, and then Newark. And these are accurate measurements from the DEP, primary reference methods. And we see that there's only about a 10% or so or less really difference between the Elizabeth lab, between Jersey City and Newark firehouse backgrounds. So really the difference, the maximum difference really that there would be, I think likely, is that difference at best is due to that urban background, is due to that hotspot of exit 13. And that's a small difference. And the reason why it's a small difference, again, is that diesel particulate matter from sources close to the source is very, very small particles, don't contribute a lot to the mass. And so if you consider that, again, the Elizabeth lab is being perhaps close to the maximum hotspot you might find in New Jersey, that a monitor like the purple air, which measures PM2.5, like was what measured here, that has a 10 or 15 or so % margin of error, is not going to be able to detect. What we know is from the elemental carbon measurements done 4 or 5 times or more greater exposure to diesel particulate matter at exit 13. Hopefully that's clear. I'm sure I can explain it more to the council later in terms of that. I don't think that PM2.5 is a good measure. Even when you have a good monitor, like here shown in this data, the DEP's central site monitor, it's really hard to detect diesel particulate matter in a hotspot as PM2.5 because of the fact that it's not a good marker for diesel particulate matter. Next slide, please. So again, just to emphasize, again, there are big differences in elemental carbon, if we can measure that. Next slide. There's other ways of measuring diesel particulate matter that are more specific such as black carbon, which I've done some measurements. These are personal measurements in Newark with children who are wearing these black carbon monitors. And the next slide. And then we know that downwind of major roadways, like here in California, downwind of Santa Monica, Route 405, I think, or something, that there are out to a mile or more, 1,500 meters or more, measurable doubling of other types of markers of traffic emissions, such as ultrafine particle counts. Next slide. So my recommendation is that we need to think beyond what we're currently doing in terms of community monitoring, with PM 2.5 monitors or with purple airs or any type of PM 2.5 monitor, and start to think beyond that. There's limitations in how to do that. Black carbon monitors cost over $6,000 each. The ultrafine particle monitors have limitations, and they cost $12,000 or more. And I'm not saying that we should abandon what we're currently doing with purple airs, but I think we need to align our expectations and not oversell the use of purple airs and other PM 2.5 monitors, for this purpose, because I think that can really damage relationships and trust when, we're using the limited resources of community groups, as well as of the DEP, and as well as of academics like myself, pursuing projects that are unlikely to give us useful information. And the worst thing is, because of the lack of sensitivity and specificity, perhaps getting false negative results that seem to indicate there's no differences between sites when actually it's because we're using the wrong tools. So I think I might have gone over a little bit in time, but I appreciate the opportunity to speak with you.
Yes.
I think you can take that down from the screen, George. Oh, there you
go. Okay, hold on. Thank you very much, Bob. I mean, one of the things we did have here several years ago is review of these monitors that are not FDA, or I'm not FDA, EPA certified, so to speak, that have limitations. I mean, and it will cause a report of a fire, so to speak. Everybody will go running there, but it's measuring something that maybe not worthwhile, or it will create more havoc than we have reality. So we will need your input as to what the best way to proceed, because it is important. But one question in the time limited we have: if I took a point source, which is limited, as a previous speaker said, 4%, and I took 4%, are those located near EJ communities versus mobile?
Well, generally, yes. I think, around the state and around the country.
If we looked at a map, I would love to get a map looking at all the point sources, and then we can look at quote unquote the EJ communities and see if they overlap. Because my next question would be, what's the distance of transmission of air toxins? Like pollen, it could be 30 miles, 50 miles, traveling by air. What's the distance traveled by air toxins from a point source?
Well, it varies, the fate and transport of various compounds. Some of them degrade or, convert into other things in the atmosphere. They're all sort of dispersed from a point source. The EJ screen, the EPA's, you can easily see where major point sources are in New Jersey and around the country, and see how they are relative to, and I think now the EJ map, the New Jersey EJ map also is a tool for doing that. Okay,
thank you very much. And questions again, we'll be limiting to, if anybody has questions from the council, please send it to them so we can have that participate in the report. So with no further ado, I'd like to keep ourselves going on here. I'd like to ask Barbara Goun, who's a master's in public health, Dr. Goun, who's a research science and principal investigator for the NJD Department of Health. She's worked with the Department of Health for the past 20 years and as a PI, principal investigator, for the CDC-funded Environmental Public Health Tracking Cooperative Agreement, which is multifactorial. I think this may be one of the ones that someone was also looking to do the pollen, because the CDC would like to get more of the pollen information into, because it does compound and add to the inflammatory reaction associated with air pollution in general. But no further ado, Dr. Barbara Goun.
Hey, is it live? Great. Hi, I'm Barbara Goun. I am the principal investigator with New Jersey's Environmental Public Health Tracking Project. I'd like to recognize Richard O'Pekin, who many of you know, who is the data coordinator for this project. It would be remiss. And these slides are the product of both Rick and I. Next slide, please. Am I going slow enough? You good? So you'll give me the signal if I'm too quick. I'm going to do a rather different presentation. Since I'm not an air person, I'm an epidemiologist by trade and training. And I'm going to be talking about cancer epidemiology using both US, national, worldwide, and New Jersey specific data. I want to provide an overview of what the lit is on this topic, especially since so many people who are attending this meeting, both here in the room and remotely, this isn't their topic, it's my topic. So I hope that I can help everyone have more familiarity with this important question. And I'm going to sort of skirt away from the air issues that you guys are better at DEP and other places, much better able to address than me. Next slide, please. This slide is one of the most famous slides in epidemiology. I actually remember this slide as a graduate student in my PhD program, but for those people in the room, it only went to here. And now it's so much more robust and complete. So what we see, the important thing I'd like to point out is, I wish I had a pointer. Is this a pointer? Can you show me how to use it? Rick?
You may make your point, but we don't see it. You probably have to use your finger on the computer.
I don't have a computer.
Oh, so it's not that. Okay, sorry.
This one here? Oh, okay. So we're going to talk about the slide for a second. This is male age-adjusted cancer death. We're going to look at females right after this, so don't worry, we're getting there. This line here is the important one. This is lung and bronchus. That's the normal grouping that's used for looking at lung cancer. It's mostly lung, but bronchus is always linked with it. And as we can see, this is 1930, so this is not just a 20-year look back. This is a really serious look back, folks. We're seeing it's rising, and then right around here, we see it reaches its turning point, and during the 90s, it's decreasing. So this is US-wide. Next slide, please.
Next slide.
Next slide for females, I guess.
Thank you.
Here we go.
Now we have females. We see the same trend. The other cancers, especially, I liked this slide for you guys who are remote. You can see, I hope that you'd be able to see it on your monitors pretty well. Pardon? Okay, continuing along. We have other types of cancers: stomach, liver, uterus, pancreas, colon, rectum, but the important breast is here. What I wanted to really point out is, no, don't do this to me. Put that slide back how you had it. It was perfect how you had it before. Thank you. Here we have lung and bronchus. We see in women that the curve is very similar, but less high. Next slide, please. So what do we know about air pollution and cancer? Overall, this is very general. This is the overview from way high up. We're well aware, man-made and naturally occurring air pollution is known to cause cancer. Evidence comes, particularly the original evidence came from occupational studies of highly exposed workers. And for those of you who are classicists, this would include chimney sweeps, probably is the oldest study. And then topside coal workers, all types of cancers that are historically known and very well established. Historically, we had diverse exposures: tobacco smoke, radon, chemicals, metalloids, and fibers. and they've all been classified as carcinogenic. And I have citations for these if you need them for your own future use. Next slide, please. So what do the EPI studies of ambient air pollution, not occupational air pollution, but rather ambient and communities say? We certainly see an increased risk of lung cancer in association with exposure to PM 2.5. And we see this risk in both smokers and in non-smokers. We certainly also see lung and bladder cancer from multiple studies associated with higher levels of occupational exposures to diesel exhaust. So, these are working populations that are exposed probably to higher levels than most community members would get. But this is a very important epidemiology to look at the most exposed populations. There certainly are risks of lung cancer associated with indoor exposure to radon and its decay products. This is well established originally in miners. And secondhand smoke has been repeatedly shown to be associated with lung cancer among non-smokers. Next slide, please. So let's talk about lung cancer, especially for those of you who are air people and are not cancer people like me. Lung cancer is the most commonly diagnosed cancer, 2.2 million cases, and it is the leading cause of cancer deaths worldwide as of 2020. I do not expect this has changed recently. It has been a leading cause for a very long time. Lung cancer is also the leading cause of cancer deaths in the US. This has been of long standing, and it accounts for 1 in 5 US cancer deaths. So this is, the leading cause of cancer, a very important point. The American Cancer Society estimated that in 2023, there'll be over 200,000 new cases of lung and bronchus cancer and 127,000 deaths from lung and bronchus cancer. So these are really serious causes of incidence, new cases of cancer, and mortality. This is the worst part of this. Lung cancer remains highly fatal. It currently has a 5-year survival rate of only about 18 or 19%. The 5-year survival, however, is 56% if the cases were detected in stage 1, where they're still localized within the lungs. Unfortunately, here's the bad news. This rarely happens. Most cases are detected when the individual already has metastatic cancer. In that case, survival is poor. And this has been established and long-standing. Next slide, please. So what do we know worldwide about lung cancer? There's great variation in both males and females worldwide. We've listed on the slide where we see more or less. Males are high in Micronesia, Polynesia, Eastern Asia, and in Eastern Europe. Females have the highest incidence for lung cancer, however, very different. North America, Northern and Western Europe, and in Australia, New Zealand. This is not a distinction the women of America need to be in or to have. And this is North America, not just the US. Cigarette smoke probably accounts for the majority of lung cancer. Some researchers place that at 80%. The number's not rock perfect, but I would professionally say, 70, 80% is very solid in terms of the science. Ambient air pollution and exposure to household burning of solid fuels. So that would be like wood stoves, using peat and other sources of burning in the home, residential radon, secondhand tobacco smoke, asbestos, and some other more minor things also have been, including some occupational exposures, have also been clearly associated with lung cancer risk. Next slide, please. Thank you. this is a map of the age-adjusted lung cancer mortality rates by county for the US. We blended 4 years together to get good, stable counts and numbers. And when we look at New Jersey, we're sort of up here. We're not as bad as some places. We sort of see a belt up in Maine, and then we see this central area here. We also see a really wretched rate up in northern Alaska and in some of the counties out far west. Next slide, please. So let's talk about, since this meeting had a theme of looking back for 20 years, I tried to go with that theme. And we're looking at the trends in lung cancer incidence rates. Just for those folks who are not familiar with the sort of standard terms that I use, incidence means the number of new cases versus mortality, deaths from the disease of interest, okay? So that's what an incident rate is. You can only be incident or dead one time from an epi point of view. So this is distant, meaning the cancer has already spread to well beyond its origin. And then we're looking at this by race, because we're always interested in New Jersey in both looking at data by race and for EJ purposes. This is very important. And what we see is that, this is US data. What we see is that the incidence is always highest when it's being detected distant. And then we see the local, so that would mean it's only located where it started. We don't see those rates changing that much, local, local, local. They're very similar because all races is largely a mix of whites and African-American individuals. So that's what we're seeing. Thankfully, we are seeing the incidence is declining as we get up towards more current day. Next slide, please. And then if we look at this by ethnic groups, AAPI is American Indian and Alaskan Native, and that's AIAN, sorry. And this is, I believe, Asian Pacific and, let me remember. Oh, AAPI is Asian American and Pacific Islander, okay? So these are not huge parts, but they're important to look at all these different ethnic breakdowns. And what we see is in males, the rates are coming down. The dark blue here is the white. And we see in females, it is declining, but not as much. And it did rise here from 1990 up to around what we sort of say the turning point might be around here. So we do see that it is declining now, and we see that the rate is continuing to decline nicely in males. Next slide, please. I'm going to show the New Jersey data in just a minute. So here we address the question of what's happening with people smoking. This is a very important point that you cannot skip in any honest presentation of lung cancer. So if we look at the trends in smoking prevalence, this data is from Burfus, which is a telephone survey. So this is on self-report. Oh no, sorry, this is a different survey. I'm wrong. This is the National Health Interview Survey. But the data is very similar to what Burfus found. So we see races combined, and we see males, blacks, whites, females, blacks here, whites there, all continuing to decline. Next slide, please. Okay, so now we're going to switch to New Jersey data. Up till now, I haven't done anything specific to New Jersey. Now we're all New Jersey all the time. And what we see, this is PM 2.5. And we're looking during the years that we were sort of asked to think back. And what we see, this is by county, There are 15, I believe there are 15 counties with monitors for this. And here we see a kind of, bouncy, but continuing to decline over the time interval. Next slide, please. Now we're getting into what does environmental public health tracking have on air quality and cancer? And this is the one time I was going to say, can you make this one bigger so we can just see the center of it? Perfect. Hold that there. So what we have is we have outdoor air. These are indicators. New Jersey SHAD is the New Jersey State Health Assessment data. This is a publicly available website available through the New Jersey Department of Health, funded in part by the grant that we have from the CDC. And it also supports other data for any data that needs to be put up and made publicly available for the Department of Health. But we also put up some environmental data, and we have FAQs and resources, a lot of times sending people directly to DEP, and then we have indicators. So we have all these relevant air quality indicators. Next slide, please. Okay, this is the first data that I specifically got and prepared just for this talk. So this is data that has not been shown previously. I'm glad to show it to you guys. It's lung and bronchus cancer incidence up through in 3 time periods. And what we see is, here's the 3 time periods. You can see them on the bottom. Blue is the oldest 10 years. Orange is the middle 10 years. And gray is the most recent 10 years. So 2011 through 2020. And this is the trend in incidence for lung cancer in New Jersey. And this is a complete ascertainment. This is not a sample. This is the actual data from the New Jersey State Cancer Registry. And what's interesting is in males, we see perfect lineup of the curves falling through the 3 different 10-year intervals. In women, though, in men, the oldest time period, that's shown in blue, it has the highest rates, but it's very funky in women. The highest rate, the oldest time period has the lowest rate. This is what the data tells us, but it's pretty funky. Next slide, please.
Smoking goes down, but the cancer rate in women has gone up.
And then if we look at this a little differently by summarizing it, what we see for all the data people in the audience, what we see is the lines are going to converge. So the female line is the orange and the blue line is the male. And if we extend them out, coming very soon to a state we live in, we're going to see the lung cancer rates actually either cross or join together. And this data also came to me directly from the New Jersey State Cancer Registry. They were kind enough to do special runs so that I could present this data today. Next slide, please. Can you make this the regular size so we can see that slide a little better? Thank you. Okay, so what we see here, side by side, directly from the CDC Environmental Public Health Tracking website, is on one side, we see the age-adjusted lung cancer and bronchus for that interval, and then we see the current smoking. This is not as pretty as we all would like. What we see is it doesn't line up perfectly. And this is current smoking, adults only. And this is directly from Burfus, but then they modeled it because they only collected, when New Jersey Burfus is collected, they collect enough sampling to get an answer for every county in New Jersey, but not enough to go below because the cost of the survey is quite high. And this, of course, is collected from our cancer registry. And then they modeled it down to every, I don't know if this is census tract, I'm not sure what this is, but here it is. And what we see is we have a light area here with the least smoking, and we sort of have some lighter areas for lung cancer here, but it's not going to correlate perfectly because also lung cancer probably has a 30-year time period to develop. So this is current smoking, and this is people developing lung cancer. So the mismatch of time is it's not perfect. Next slide, please. And then finishing up, we're almost at the end here. We have the US cancer, lung cancer deaths, and then below in New Jersey, we see that New Jersey is below the nation, but we don't look very different really. The curve and trajectory is very similar, and it's pretty easy to see. And that's my last slide. Next slide has my contact information. If you'd like to reach out to me, please do. You're welcome to email me directly at my email that I'm providing. And also, in case you're interested, here's our NJ SHAD site. If you want to look at the data, we have both queryable data and health and environmental indicators. And then I have to give a plug to our newest product, which is Healthy Community Planning. If you're interested in data by municipality, that's where you want to go. Thank you very much.
Thank you very much, Dr. Goun. I do have a couple of questions. Number one, if you look at the male and female track for lung and bronchus, actually women started to peak later than the men. So therefore, when you show the merging of the two, is that the males are coming down to the females at the time. So it really, there is a disparate timing in years of that overlap. So I wanted to highlight that, because if you put those two, just the lung, male and female, the women are developing it late, or are now developing it and are moving down, whereas the men were developing in the, I will say in the military, World War I and II, where they were smoking a lot more than they are today. And that could be a post-war or post-whatever period, an event in that regards. You want to comment at that? Because that's where I see them merging the two.
I think what we're seeing in the lung cancer rates are a couple of things. We're seeing the combination of beginning smoking, ending smoking, and volume of smoking, because it's not really, for Burfus data, you get yes, no. But the truth is, ideally, we'd prefer to have like packs per day. And that changed over time as people started to cut back on their smoking. And, but women, I think, entered the smoking, women started smoking later, and men were already heavily smoking at the Surgeon General's report and were quitting. We also see that quitting is very difficult, as those of us who work in the lung cancer and health world know. And so, people don't necessarily quit, but they might diminish their smoking. So yeah, the pattern is that pattern is pretty perplexing, and I've not ever seen that. And we were just talking to the cancer registry. We're thinking of maybe doing a one-page, like little mini fact sheet with that one graphic on it that shows the disparity, because we're not sure that data's out yet. And I'd like to thank Lisa Paddock at the New Jersey State Cancer Registry for providing us with that data so I could mess with the graphics. I never know what the data says till I mess with it, and usually, make it visual.
Hey, Len.
Okay, well,
Len,
thanks, Richard.
Could I jump in for a question?
Yeah, go for it.
It's Toby Hanna. Thank you, Barbara.
Go ahead.
I was hoping to ask this to a couple of speakers previously, but we've been running out of time, so I have to butt in and ask here.
I'll try.
But with all of your data and your analysis, you came pretty close to the question I'm asking. And if you don't have an answer to it discreetly, maybe we can talk about how we might get there. But we heard a lot from DEP this morning about all of the actions they've taken. We've taken, whether in New Jersey or across the country, for 20 years, 40 years, whatever window you want to look at, to minimize air toxics. We looked at lots of ambient monitoring data to show the trends, the pollution is coming down. We heard from some industry representatives that have talked about the investments that they've made to follow regulations and comply and reduce pollution. What we always seem to be missing, though, is the data to show from a health standpoint that the benefits are there. I mean, you talk a lot about smoking, but that's not the air toxics from the state and its transportation, from industrial. Can we quantify that is really my question. Is there any way to parse the data down to that level?
Can you put up my recommendations? This is very apropos. Thank you. It'll take a second, but in the meantime, we'll talk. It's very hard to quantify.
Sure.
A lot of these studies are ecological, which don't really, from an epi point of view, are not the best. But they're not bad studies. They're well done, but they're not able to quantify that number. Ideally, as an epidemiologist, I'd rather have like case control studies, but they cost a fortune, and you can't wait for people to develop lung cancer. It would cost a fortune, and it would be unconscionable to not counsel everyone to quit smoking. Entirely unconscionable.
Right.
Thank you, Rick. So, whoops, we had my slide for a sec. So I'm saying we need further research on indoor and outdoor air and the consequences to guide exposure. But these are what I've submitted as my summary and recommendations.
Is there a pathway to that? Is it within the realm of possibility? At least it's not going to be purely quantitative, but to be able to.
Oh yeah, I totally believe it's possible. I do feel, from my point of view, and now I'm speaking as an individual, not representing the health department, because you're asking me a great question, so I'm going to answer it on the fly. So this is not like the health department speaking. This is Barbara Goun, Ph.D. in epidemiology speaking. I think it's doable, but it really should be done with the type of epi study that is expensive and time consuming if you really want to get quantifiable. But I'm very hopeful, because air pollution causes more than lung cancer. It has multiple health impacts that are well proven. So we have to decrease exposure, not just based on one endpoint, but on multiple endpoints.
Yep. So we're showing we're decreasing exposure, but
we should.
Okay, and that's happening. But the missing link then is what are the benefits of that reduced exposure? And within those benefits, where are there still benefits to gain that are meaningful? And you can't evaluate the cost benefit of future policy.
Your question is a great one, but it could be a whole course in graduate school.
Yeah.
So I'm afraid I can't answer your question. Can we take another? Do we have time for another question? No more time?
Well, we have a little time, but in addition to that, you can't parse out deaths in a generation. It takes 40 years. You see the impact, 20 to 40 years. So obviously that's, but I would love from Dr. Goun to get more specific, because what Toby's raising the question, can you parse out the impact of air toxics on the health and cancer specifically? And your answer is that you can't really do it very well with the present database. But nonetheless, you do recommend that specific studies be done, and you got to start now to see the impact. Because, like I say, it's 20 to 40 years. It's not going to come back in 5 to 10, because the numbers of, as you've shown, have decreased in the past 20 years. But that implication on impact on lung and bronchus won't be seen for another 20 years, if it really does have an impact.
And there are so many other risks and adverse health outcomes to air pollution. We can't only worry about lung cancer. We have to be concerned about acute effects. We have to be concerned about other disease, concomitant, the effect of air pollution on concomitant diseases. So there's a lot going on here. I'm only addressing a small part of it, talking about lung cancer, but there's a whole course possible on what is the impact of lung cancer, of air pollution on health.
The other anybody else from the clearing from the council have a question? If not, Dr. Goun, thank you very much. But I would love to have it more in writing. I think maybe I'll look at your slide regarding the development of additional studies that need to be started now for long-term assessment and design for the proper assessment of what actually Toby, Dr. has raised. Oh, thank you.
Thank you.
So I'd like to pass the mic on, so to speak, to Barbara Morin, who is an environmental analyst at Northeast States for Coordinator Air Use Management, which is otherwise known as NESCAUM, an interagency association of 8 of the northeastern states. And she has been working on a variety of air toxics and public health issues, as well as environmental justice within that umbrella organization. But before she started working at NESCAUM, she worked for the state of Rhode Island for over 30 years in their environmental management's office of air resources, as well as the health office of healthy homes and the environment. So I pass the mic on to Barbara Morin. Thank you.
Thank you. I really appreciate having the opportunity to address this council. As you said, I'm working for NESCAUM, and as such, and have the honor of being able to work with a number of staff people from New Jersey DEP on a variety of area issues, including air toxics. I guess, George, you're controlling the slides, right? Could you go to the next slide, please? Thanks. So we're very impressed by a lot of the accomplishments that have already come through New Jersey DEP for air toxics over the years. Particularly notable are the permitting program, which includes the analysis of short and long-term risks of a range of air toxics from stationary sources. And it certainly has resulted in some controls being, additional controls being instituted where necessary. The incorporation of environmental justice considerations in the permitting process. And I have to say that even though I realize that the new rule was just announced this week, a lot of considerations have already been put in place. For instance, increased public participation and notification that it's not always easy to implement. Certainly the innovative fumigation rule, which is substantially reducing local risks from those fumigants. And then also the New Jersey DEP worked with, from our understanding, worked with other states to make sure that those operations didn't just get transferred to another state where they wouldn't be regulated. We are very happy to see the diesel particulate cancer risk map on your website. That's even though EPA's air tox screen and before that NADA did evaluate exposures and ambient concentrations of diesel particulate, they do not calculate cancer risk. So that's such an important exposure. We're very happy to see that on your website. Certainly the monitoring of the ambient levels of the air toxics, at the organics at 4 sites and the metals at 6 sites, which enabled comparisons both within the state and between states, or among states, I guess it is. It's very important. And we're also very impressed by kind of the usability of the website, including the What's in My Community interactive mapping website, which I think gives a lot of valuable information to community members. And then also well-designed and very informative websites on information on subjects like air toxics and community air monitoring projects, which are successful in providing information about complex topics in language that's accessible to a variety of lay people. Next slide, please. So the continuing concerns that I wanted to address today are in 2 areas. One is exposures to ethylene oxide And the second, the impact of emissions from petroleum refining, storage, and distribution sources in the state. Next slide. Okay, so I'm not sure if this has already been discussed because I couldn't stay on for everything this morning, but according to EPA's 2019 air tox screen analysis, modeling analysis, which I think has been discussed quite a bit today, the pollutant associated with the greatest risk to any of the New Jersey census tract, the highest cancer risk, is ethylene oxide. It may not have been the case if they included a diesel particulate and cancer risk, but at any rate, that's how it came out, and certainly New Jersey was not alone in that. Predicted ethylene oxide risk for the highly impacted census tracts is almost totally associated with emissions from ethylene oxide sterilizers, which are used mostly for medical equipment sterilization, but also in some cases for sterilizing some other materials. The highest predicted risk for any census tract was 151 per million. That analysis assumes that there's no ethylene oxide in background air, zero concentration in background air, and that there's no ethylene oxide that's formed in reactions in the atmosphere. And in that way, it's different from, say, they assume that there's a certain concentration of carbon tetrachloride in the background air. That formaldehyde is in the background air and is formed in reactions in the atmosphere. But for ethylene oxide, they assumed it's zero except where you have a source that's impacting. Next slide, please. So the last few years, New Jersey DEP has been monitoring for ethylene oxide as part of their VOC samples at their 4 monitoring sites. And the levels that they're seeing of ethylene oxide in their monitoring results are much higher than what's predicted in the EPA model, even though those sites aren't particularly near any big sources of ethylene oxide. They're, in fact, between 200 and 2,000 times higher. The monitored values compared to the model values are between 200 and 2,000 times higher. And even if you compared these sites that are the monitored values at these sites that are not particularly near a source, a known source, with what EPA's model is predicting for the highest impacted census tract, is still 10 times higher in these kind of background sites than they would be at this maximally impacted. So that's kind of a concern. Okay, the next slide, please. So this is not just an issue in New Jersey. Those discrepancies between monitored and modeled values exist in other states. The first 4 here are the New Jersey sites, but you can see this shows monitored concentration, mean monitored concentration divided by the modeled, and it's well within the kind of ratios that are being seen in other states as well. Next slide, please. However, one thing that is different is that this here, if you look at the slide on the left, it's the monitored values, and it compares New Jersey with the first 4 in New Jersey, the next several in New York, and then there's Pennsylvania, and then some other states after that. And the monitored numbers in New Jersey tend to be higher than in most of the other states, except Pennsylvania shows up, the Pittsburgh, Pennsylvania site shows up as being a similar range as New Jersey on this graph. There also are a couple of others in other parts of the country that are kind of in a similar range. I think Oklahoma and Arkansas, maybe, I'm not sure. At any rate, if you compare the ones that what you're seeing in New Jersey, for instance, with what you're seeing in New York, it tends to be about twice as high in New Jersey as in New York. And if you look over to the other graph, those are what was predicted by the air tox screen for the census tracts where those monitors are, and you're not necessarily seeing that kind of discrepancy where you would expect a lot higher numbers in New Jersey than in New York. And I have to say that point out that the scales on these two graphs are really different because, as I said, the predictions for the modeled concentrations are much lower than for the monitored. Okay, so the next slide. So this is kind of a dilemma, and we feel like that it needs to be followed up because ethylene oxide is predicted to have such a high risk in comparison to other pollutants. So to try to nail this down better, I think it's important. First, I think it's important to try to identify the reasons for the discrepancies between the model and the monitor concentrations. To the extent that you believe that the monitored values are correct, you may need to be looking at what other sources are being left out of the air tox screen analysis, and also whether there are background levels that are present that just are not being included in that analysis that should be. Also, I think it's really important to identify the reasons for why the New Jersey monitored concentrations are higher than those in the other states, and I'm actually especially interested in the comparison with New York. So one of the issues is that ethylene oxide is a notoriously difficult pollutant to measure accurately in ambient air. And that's due to both problems with the sampling itself, because it can actually grow in a canister. So after you collect a sample, it can actually increase if the sample isn't analyzed very promptly. And some canisters, it grows faster than others, and there's a lot of sort of unknowns with that. And then also with the analysis that there can be interference that you can end up mischaracterizing some of what you think is ethylene oxide might actually be an interferent with another compound. We noted that New Jersey and actually also Pennsylvania, which had the high Pittsburgh monitor, used the EPA contract lab, which is ERG, to do the analysis of its VOC cans. New York has actually spent a lot of energy over the past several years really refining their techniques for ethylene oxide to try to eliminate a lot of interference and kind of figure out like what the best techniques are to get the most accurate numbers. So that may explain some of the differences. With the three other states, I think that I identified that also had higher ethylene oxide numbers. Two of those also used the EPA contract lab. So there may be partially a difference of how long the cans wait before they're analyzed, if they're sent off, or there may be some other differences in the techniques that partially explain the differences. One thing that's happening now is that EPA just in the past week or so proposed some new regulations for synthetic organic chemical manufacturers that included some requirements for fence line monitoring of several air toxics, including ethylene oxide, and said that they were proposing some refined monitoring and sampling and analytical techniques for more accurately measuring ethylene oxide. So hopefully that will help with that issue. But even with the refinements, it's likely that the ethylene oxide measurements may continue to be higher than what would be predicted by the EPA modeling analysis, and that we may need to look further into why. One thing that we noticed in Rhode Island actually was that there seems to be some formation of ethylene oxide and photochemical reactions in warmer months, similar to ozone and formaldehyde. During the afternoon of a high ozone day, you also often have higher ethylene oxide. So that's another effect that probably needs some further evaluation. Okay, next slide. And I just quickly wanted to say a couple of things about petroleum refining, storage, and distribution emissions. We had hoped to have more data on this to show, but these are actually some older slides. George, can I ask you to not show the slide? Sorry, we had yeah, okay. We had
Hold on for 2 seconds.
Yeah. I apologize for this, but we had been doing some preliminary work, but our funder didn't want us to show preliminary data until after it was peer reviewed, so we can't do that right now. But what I can say is that obviously at some of the sites, for instance, right, great. So just a quick comparison to the two of your monitoring sites, the one in Elizabeth and one in Chester. The benzene levels are typically quite a bit higher at the Elizabeth than at the Chester.
Hold on for 2 seconds, Barbara.
Yeah, that's great. Thanks. And
hold on. I'm sorry, Barbara. Hold on for 2 seconds.
Yeah.
Barbara, can you go back and start over for the petroleum refining? This was not being recorded.
Oh, okay. All right. So the second topic I wanted to address was issues about potential impacts from petroleum refining, storage, and distribution sources in the state. The one thing that we looked at was that the New Jersey DEP monitor at Elizabeth, New Jersey, has benzene concentrations that are roughly twice as high as the one in Chester, New Jersey, and that's sort of probably largely influenced by that the one in Elizabeth is close to the New Jersey Turnpike, and the emissions from the mobile sources are definitely impacting it. But there are also several bulk terminals that are in that area. NESCAUM has been concerned for a while about impacts to ambient air from various sources of petroleum storage and distribution and refining. So that's something that we think warrants further further investigation. Next slide, please. So one area that we were interested in is the area around Linden, New Jersey. There are a number of tank farms, and there's the Bayway Refinery, it's a little north of there. And it's a community that's considered an overburdened community. So we, kind of concerned that there's likely could be impacts in that area from some of those sources. And as I said, we're currently supporting some work to investigate VOC emissions and to kind of figure out where you're seeing elevated levels of various VOCs to do some source apportionment to figure out what the sources are. We don't have results we can share about that today, but We hope to have those ready in early 2024, and think that this is definitely an area that warrants further investigation. Next slide, please. So, as a follow-up from that area, we think that it would be a very important thing is increased monitoring of the vicinity of petroleum facilities. I think Joanne mentioned this morning the fence line kind of monitoring in neighborhoods around those facilities, and you can do some continuous monitoring. It gives you a better idea of, being able to, associate emissions with particular activities at the facilities. And you can also look at more like spatial differences as you move away from a facility. And one thing that's sort of coming down the line, and has been mentioned before, a lot of the community monitoring projects that have been done to this point have been largely done with purple air or other sensors that are mostly looking at particulate. But there are some new, it's kind of a new group of low-cost biosensors that are coming down the line now that are being evaluated that show a lot of promise, that look at VOCs and in real time, and that those kinds of things may be valuable to kind of better characterize what's going on in terms of local impacts and sources. And then, because you already have a 1 hour average benzene benchmark, as well as your annual averages, you certainly could use those data profitably to evaluate impacts, both in terms of calculating risk and also identifying activities or sources that are contributing to elevated concentrations. That's what we had to say. I'm very impressed with the program in general, and just a couple of areas with some suggestions.
Thank you very much, Ms. Morin. Question I have is that based upon your own comments, can I trust the numbers that we find here in Jersey regarding ethylene oxide being 100 times more than the EPA modeled? Meaning, if you're telling me that there are problems with the measurement devices, then that's a problem in itself. That should be stage one. How can you measure something you're not sure that you're measuring? I really have a problem with that being discord, because if I present that data, we look like I'm doing a disservice to the state, but I don't have the right numbers.
Yeah, I think that the monitoring issue has to be really worked out. It's not a New Jersey issue alone by far. Hopefully these refinements that EPA is suggesting will help to some degree, but from what I can tell, and talking to some of the people in New York that have been working in this area for quite a while, it'll help some. It's not gonna make the problem go away. So maybe it may bring the concentrations down more similar to what you're seeing in New York, but it is still quite elevated. I think that there's a lot to this. This is sort of still a mystery area that just needs investigation, because if it's really true that the concentrations are that high in background areas, then that's a real significant risk factor. But
right, but how can you put
right.
something on like subjective data? It's not objective yet. It's really, I feel uncomfortable as a scientist.
Yeah, no, I agree. But at the same time, EPA's assumption in air tox screen that the zero background, I think, is not correct either. So,
well, it's like the arsenic. No one in this room or participating could live without arsenic. Arsenic is required for your bones. However, it's the amount of arsenic that is the problem, and the dose over a period of time. And that's, I think, what Toby was reflecting, and said, what's the health effect? We do need some of these things, whether we like it or not. It's not zero. Is there any other questions from the council, please?
Len, thanks for name checking me again. It's Toby. I would like to ask Barbara a couple questions about the bulk storage study that you're doing. First question, I guess, is how soon is that going to be conclusive, or when would you expect to have, I don't know whether you're issuing recommendations or a report or a study? What's the timing on it?
Yeah, we have some sort of preliminary work, but they're going to do more monitoring this summer, and then they're hoping to have, something that's kind of peer reviewed and ready to be kind of released to the general community like early 2024. That's the timeline right at the moment.
Okay, and it sounds like what New Jersey's been working on that. I've been helping lead a stakeholder group on bulk storage terminals for benzene emissions for the past year. And you're aware that New Jersey's subjecting all of those facilities to facility-wide health risk assessments for their permits. That's not actual emissions monitoring, but that's looking at their potential to emit and whether that's acceptable at the fence lines and in the communities. And that would be looking at both the one hour benzene benchmark and the annual. And I think you're probably also aware that nearly all of the refineries in the country at this point have EPA reference method fence line monitoring requirements under MAX standards, and they've been reporting under that for 5 years now, I believe, and all of that information is publicly available. So, and that is for benzene at the fence line. So there's tens of thousands of data points out there on benzene at refinery fence lines that might factor into that as well.
Mm-hmm.
Thank you. Any other questions from the council? Toby, you have any more questions? Because it's you've been very poignant on this.
No, thanks, Len.
Okay. Thank you very much, Barbara. This will close the quote unquote the invited speakers, but we now open it up. I don't have a list in front of me.
Glenn, we have a list.
You do.
We have two people signed up. Just as a reminder for our